go.
Hello, my name is Catrice Blakely, and we are here this evening to represent our three last final video. Go ahead and introduce yourself.
Hello, my name is Dev, and I'm a student pursuing respiratory therapist.
Hi, my name is Florienca. I'm also a student of respiratory student.
Mhm. And right now we're going to be discussing a scenario that some doctors had just went over, and we would like to explain them further. I have the rapid sequence intubation. The rapid sequence intubation, which is RSI, is an airway management technique that induces immediate unresponsive induction agent and muscular relaxation neuromuscular blocking agent. And this is the fastest and most effective means of controlling the emergency airway. The sensation of spontaneous ventilation involves considerable risk if the provider does not intubate or ventilate the patient in a timely manner. RSI is particularly useful in the patient with an intact gag reflex, a full stomach, and a life-threatening injury or illness requires immediate airway control. Modified RSI is a term sometimes used to describe variations on the classic RSV approach, e.g. ventilation during apnea titration and inducing agents. Modified approaches tend to trade an increased risk of aspiration for other benefits to prevent respiratory acidosis due to apnea from compounding severe metabolic acidosis. That concludes my subject.
Okay, so that's an amazing presentation by my friend Catrice. Now I will go through the parasites and anesthetic agents. So parasites are used as a part of general anesthesia, and they are majorly used to prevent movement during surgery. Once the paralytic medication is given, the ventilator and breathing tube are necessary. This type of medication is given through IV skin, and it is only available in hospital and surgery facilities. Uh, Succinylcholine is a good example of paralytic, and it is a rapid onset, which means it's a short-acting depolarizing muscle relaxant. And succinylcholine has traditionally been the drug of choice when the rapid muscle relaxation is needed. Then I will talk more about anesthetic agent, which is my next topic. Any agent that produces a local or general loss of sensation, which includes pain, are called anesthetic agent. Anesthetic achieve by this effect on the anesthetic is achieved by this effect on brain or peripheral nerve system to suppress response to sensory simulation. The unresponsive state thus induct is known as anesthesia. There are different type of anesthetic drugs agent, which include uh, analgesic, which is a pain reliever. We know a good example called Tylenol. Narcostatic. There are also anesthesiologic, which are called sedative. There are also local anesthetic, general anesthetic, intravenous agents, and paralytic agent, for example, muscle relaxant. So that's done with my topic. Now, Florencia can go ahead and explain the next one.
Thank you, Dave. Thank you, Catrice, for the explanation. And my subject is about drug overdose and opioids. The first thing I'm going to do, I'm going to give you a short list of benzodiazepine list, which is Valium, Ativan, and Xanax. So benzodiazepines is a drug primarily used for treating anxiety and also effective to treat other conditions such as seizure convulsions, insomnia, or trouble sleeping, sedation prior to surgery, muscle relaxation, alcohol withdrawal and drug-associated agitation, depression and panic attack. Benzodiazepines can cause physical dependence. To reverse the overdose of benzodiazepine is romazicon injected rapidly into the vein. Now, the opioids are a class of drugs that include the illegal drugs, heroin, synthetic opioids such as fentanyl, and pain reliever, available legally by prescriptions such as oxycodone, Vidacon, codeine, morphine, and many others.
Mhm.
An opioid overdose can be reversed with the drug naloxone, and the brand name is Narcan. Thank you so much, and this is it.
Okay, that's
Thank
awesome.
you.
Good job,
Thank
Florencia.
you.
Good job, guys.